Cool. There we go. We are live. Awesome. All right. It is 9:03, so I'll give like 60 more seconds. Hopefully some people will start to filter in to the YouTube live stream. I have a few people watching. 1 more minute. Again, thank you all so much for taking an hour out of your time to come hang out with us here at MAASIN.
Sure.
Already. Right. I think we're just going to dive in so you don't waste too much time. Hello, YouTube. My name is Ethan Pravitz. I am a physical therapist. I use he, him pronouns, and I am the chair of the MAASIN Health and Wellness Committee. This is our virtual town hall being hosted again by MAASIN, the Marching Arts Advocacy, Safety, and Inclusion Network. You can find us on Facebook, Instagram, and Twitter by searching MAASIN. If you are interested in joining MAASIN or learning more about MAASIN, please head over to maasin.net. Again, I am the chair of the Health and Wellness Committee here at MAASIN, and tonight's town hall will be focusing on physical and mental health for the marching member as we enter into the summer season. So if you have any questions about getting ready for band camp, getting ready for summer rehearsals, getting ready for maybe mini tour, move-ins, or summer tour, around being healthy, staying healthy, managing stress, these are all things that we might touch on tonight. We are very lucky to have 3 highly qualified panelists joining us. And did I say something wrong? Marching Arts Access, Safety, and Inclusion Network. Our 3 panelists tonight are Laura, Natalie, and Billy, and I will allow them to introduce themselves, starting with Laura.
Hi, my name is Laura, and most people in Georgia are known by Laurie. I am a nurse practitioner. I live in Austin, Texas currently, and I practice presently in the area of women's health, although I have also spent a number of years practicing both as a nurse and a nurse practitioner in the emergency department setting. My 50th anniversary involvement in drum corps matches DCIs this year, as I've started my marching years in 1972. I'm an alumnus of a corps called the Chessmen and then the Crossmen. And then I had 2 kids that marched each for 5 years in the Carolina Crown. I helped out with the medical care when Ethan was a marching member. Then I was asked to take over the, at that time, called the Drum Corps Medical Project, now known as the Marching Arts Safety and Health Project, which is an initiative that is completely supported by Drum Corps International. And our goal is to really support the medical teams as they take care of the participants. So.
Awesome. Thank you, Laura. And yes, Laura did help take care of me when I was a marching member at the Carolina Crown back in 2000. All right. Natalie, you're ready to go whenever we are.
Hi, my name is Natalie Mason, and I'm a registered dietitian or a medical nutrition professional. I currently work in Minneapolis. I work in adolescent health. I actually work out of the Minneapolis public schools where they have free health clinics for students. And so I provide one-to-one nutrition education and counseling for high school students. It's literally my dream job. I love working with teens and young adults. My connection with the marching arts, in high school, they actually allowed 8th graders to march. I have a cool 5 years of high school marching under my belt as color guard for 3 years, and then a major for 2. That was an interesting leap. And then I also worked as the food operations manager for the MAASIN Scouts in 2019. I was the food truck lead on the road with them, and I did some other consulting with the Scouts back in the day in the area of wellness consulting and just education and supporting the healthcare teams. So yes, very excited to be here. Thank you.
Thank you so much, Natalie. And it's nice to have someone else who did color guard on the call. All right. Billy, can you introduce yourself, please?
Hello there. My name is Billy Capozzi. I am a core member of MAASIN. I do work with a couple of our committees there. I am a licensed social worker, and I am a therapist in northern New Jersey, specializing in LGBTQ plus and a couple other components besides that. As far as my connection to the marching arts, I did 9 years in Drum Corps Associates as a member of Fusion Corps for 8 of those 9 years, and for Cadets 2, and also did 2 years of WGI with United Percussion and Front Ensemble. I currently also, in addition to all of that, am a performing member for BD Entertainment in their New York City division.
Awesome. That's amazing. I have to say I'm very impressed by all of the resumes here on our panel. I really appreciate the depth and breadth of all of your experience, not only on the healthcare side, but also on the pageantry and marching arts side. So once again, thank you so much for joining us, panelists. And thank you, YouTube. Thank you all for joining us here at the MAASIN Town Hall on health and wellness. So why don't we get started with our discussion today? So as we enter the summer season, our members and their families are going to be getting ready for summer rehearsals, for mini tour, for move-ins. Before arriving at these rehearsals or at move-in or camp, what are some things that you think our members can do to prepare themselves, their bodies and minds, to kind of jump into summer band or summer performing? Well, anyone that wants to unmute, you are welcome to start us off. Yeah, go ahead, Laura. Yeah, you can unmute yourself. There you go.
Okay. So one of the things that hopefully everyone has done by now is some type of a pre-participation sports physical exam, so that they have met with their usual healthcare providers and identified any potential things that they need to do to prepare for the season. So for example, if they've had a prior injury, they have gone to physical therapy, they know the exercises, they come to the summer with whatever braces or wraps or things that they need. If they're on some kind of medication, they have a 3-month supply or have made arrangements to get it during the season. And there are some members who are going to come with certain illnesses, or not illnesses really, but certain disease processes, like, for example, diabetes, where you're going to want to have connected with someone on staff already at the Drum Corps, so that you can make a smooth transition to make sure you have all the dietary medication needs and storage and all that kind of stuff, so that you can just really anticipate things and you just have a smoother transition to this season. One of the things that the Marching Arts Safety and Health Project does every year is we put together, or I shouldn't say we, Dr. Tom Freeman, who is a podiatrist associated with the Cavaliers Medical Group and MASH, does a lot of research all winter on different shoe models of varying ranges of price and etc. And we did publish that shoe list on our Facebook page, which is DCI Marching Arts Safety and Health. And that's easily searchable. And it's they did a really good job this year. I guess DCI also helped make it a little more presentable looking. Or maybe Tom did that. I'm not really sure. But anyway, it looks great and it's easy to understand this year. And he really put a lot of thought into it. So that's another thing, because you want to come to the season with at least 2 pairs of shoes, because you'll want to, your shoes are probably only going to last till sometime in early to mid-July. They really go through a lot of wear and tear. Yeah, I mean, in terms of the sports medicine preparation, the conditioning, I'll leave that to people who do muscle and bones. That's not my thing, but we do have people on our committee that make recommendations there as well. So yeah, that's what I can think of.
Awesome. Thank you, Laura. That was really thorough. And I do appreciate the shout out to the Marching Arts Safety and Health Committee as well, making sure that those medical teams that are on tour in the summer can really keep their students safe and healthy. Natalie or Billy, please, anything that, our marching members that are getting ready for the summer, what are some things they can do to get prepped?
So, speaking from the standpoint of the mental health side of things, a few things that I would definitely advise kind of ahead of time is, for one, have a pretty clear idea of like what we're getting into here, because, we're pretty much, regardless of circuit and honestly even time of year, what you're going to be going into is going to be like a very like physically and mentally rigorous day. And that is going to be the case on, in the for the DCI tour, you are doing that every day for several months. And, in the case of DCA, even, you're doing that every weekend for 2 long days, potentially like 2.5, depending on if your core does anything on Friday nights. So as far as things go with like the mental side of that, I would definitely advise having like kind of using some information that is probably given to them, like marching members in the earlier season, about honestly even things just as simple as like really how we breathe, and how we can kind of control our bodies. I definitely think there's a lot to be said there. If you have specific coping strategies that maybe if you are someone who's gone through therapy of any sort, you have a good working knowledge of like some of those things that you do, maybe having some things that help with like distraction or unwinding at the end of a day. I definitely do recommend and encourage doing some bits of self-care where you can. Typically the beginning of end of days are probably going to be good, or some of those like lunch or dinner blocks are usually pretty good for those times. And additionally, I would definitely advise having at least like a few supports available to you, both in your ensemble and also outside of it as well, just because, for one thing, like having people that understand your experience is a great and awesome thing. And I would definitely always encourage, like, if you have like a few people that you march with that are like good friends of yours, definitely utilizing that. But also I would advise, having a couple of people that are outside of that, honestly, even probably outside the activity altogether, just so you have like extra people that can ground you from like the outside viewpoints, especially when you're on tour and you're kind of just in it. You want to have like a person or two outside.
Yeah, thanks, Billy. I really appreciate that. I know that that's something that can be really challenging, what you referred to, like being able to take a step away on those times, especially if you're moved in. It can be challenging, but it's good to take advantage of those times. Yeah, thank you so much. I really, really appreciate that. Natalie, anything to add on the end of getting prepped for the season, or prepped for just band camp or summer rehearsals?
Yeah. So a lot of times when I work with student athletes in any context, they're really interested in the magic answer. They want to know, what specific exercise should I be doing for this? Are there any vitamins that I need to be taking? Are there any like superfoods that I should add? And I guess like to a certain extent, yes, there are like very specific targeted things that students can do, but honestly, the most helpful things are going to be getting those foundations in. So sleeping at night, moving your body somehow in some way that you enjoy, eating consistent meals throughout the day, heck, even including a fruit or a vegetable once in a while. Because like a student who comes to me and says, "Hey, Natalie, I really want to try this vitamin supplement to really get me started." And I'm like, "My dude, you sleep 5 hours a night and you eat Takis with every meal. Let's work on that first. Let's get those foundations really solid before we start working further up."
That's great to know. And especially, like I've been through like summer tour and then high school marching band as well. And like, again, as Laura mentioned, she's been through it all, put 2 kids through it. nutrition is something definitely in terms of preparation, I know that can kind of go by the wayside, especially if you're like getting ready for camp or moving in where it's like, I'm going to be outside for the next, 3 months, 14 hours a day. I want to have bacon cheeseburgers every day before I leave for tour. And like, maybe that's not the best thing to do from a nutritional standpoint. It sounds like, getting yourself ready and pre-hydrating and kind of knowing that you need to prepare your body for all this hard work is really, really important, not just physically, but also what you're putting in. Awesome. Anything from any of the three of you to add on like kind of preparation before we kind of move into being at rehearsals? Yeah, go ahead.
A small thing I did want to add as far as like some of the stuff that I had mentioned, just because as I was like looking things over, I was like, this would probably also be a relevant point. Be aware of triggers, because, for different people, coming from all different walks of life, like there might be certain things that may cause triggers, and, it may be helpful to be cognizant of what those are. And if you have somebody that you like know and trust within your ensemble, maybe informing them of something that might be, so that way in case for some reason you can't necessarily communicate that something's going on, having someone else that's available that could be like, oh, okay, it was because of this thing, and that's just something to know.
Yeah, for sure. Being able to know what you might be walking into, and then what other things could really cause you to go into that bad place. The more prepared you can be, the better we can all handle those things together. That's awesome. So once we arrive at camp or at rehearsals in the summer, again, like you all had mentioned already, it can be kind of a shock to your system, both for new members and for veterans. I know that sometimes we forget, even if we've been on the field before, that it is really shocking to show up to rehearsal in the summer after not having done marching band or drum corps for however long. What are some ways that you've already alluded to some of them, but what are ways we can handle the physical or mental stress of being at these summer rehearsals? Because, now we're at the moment, we're in our 5-hour block or we're in our ensemble. What are things to look out for, and what are things we can do to survive and stay healthy and safe?
Want me to go first? Keep going around. Okay. Gosh, it's it is a pretty big shock to your system. And it was interesting in all my years of helping out with drum corps, specifically Carolina Crown, and even when I marched, it seems like the veterans were the least prepared. Because the newbies that come in, they really take it seriously. They read everything you send them, and they're conditioned, and they're, already, used to the climate. They've they've acclimatized themselves, and they have the sunscreen, and then the vets come in. Not so much. They're like, yeah, we've done this before. And then they get caught, those are the ones and oftentimes the vets, blow it off by saying, well, 5 years of drum course is too much on your body. No, I think it's more that you probably didn't come in as prepared as you should have been, which really sets the stage for a bit of disaster. And so it's just really important to take all that seriously every single year and come in both physically and mentally prepared. Sometimes it gets tougher as the years go by. And so also, knowing yourself and knowing when you need a break. And I know that you don't necessarily dictate when your breaks are, but kind of being vocal about when you've reached your breaking point, asking for help when you need it, in whatever that way that is, being mental or physical. And, also watching out for others who are struggling as well. That's really a big part of it, through the Marching Arts Safety and Health Initiative this past year, we've really focused a lot on mental health awareness with our administrative teams, and now we have an upcoming webinar this weekend, as a matter of fact, to orient the new medical teams. And we're doing a lot of focus on mental health awareness, and some have even taken a course. There's like a mental health first aid course that some people have taken in the course. But, you know, you can't, you know, the two athletic trainers or the one athletic trainer and the nurse cannot be everywhere. So just really keeping an eye around, you know, eyes around you for people who are struggling, who may need to be able to reach out for help and not necessarily have the skills or the wherewithal to do so for whatever reason. So, yeah.
Thanks. I really appreciate that. I want to give the other two panelists a second to maybe even respond to some of that. Like Laura alluded to, taking a break or finding, you know, knowing yourself in that moment and knowing kind of that I'm getting to my limit. What are ways that we can do that during rehearsal? Like, especially on the member side, we've all kind of been there, but like, what are some, if you had to think of something off the top of your head, how are some ways you could engage either like your leadership or your staff to, you know, give you that time and space if you're really not feeling well or feeling, you know, like you're not all the way there?
I definitely think that, speaking from like a potential perspective that like staff members can take with this kind of thing, is, you know, have cognizance for when like a member appears off in some manner, because, you know, it's not uncommon. Like, it's something that you could definitely see tangibly in people when, like, you know, you start to see some of that bit of breakdown. You start to see they're really struggling to, like, you know, catch breath. You can tell if like their body's starting to really just start to like experience a lot of like physical strain. And honestly, you can see a good amount of like mental strain, even in like the way that, you know, you may have marching members respond to your comments, or, you know, depending on like really just kind of the way that they're approaching their rehearsal. And I would definitely advise like kind of creating a culture around the idea that like if you need to take a rep or two off the field, kind of like catch your breath and, you know, kind of, you know, start to do what you need to in order to kind of wind yourself down from that and pull yourself down from that point, that be something that's actually a more normalized thing in the marching arts as a whole. And again, like, you know, I know we're speaking DCI, but I think it's applicable pretty much any and all times of the year. Because I think when we normalize the culture that people should realistically be better served for taking that rep or two off, rather than being forced into this notion of just like an endless grind culture where it's like, nah, you got to push through. By doing that, I think honestly, we're going to become more efficient, not only in maintaining our ensemble's ability to like rehearse effectively, but also making sure that our members kind of have the ability to kind of not only know that they have the space to advocate for that if they need to, but also knowing that staff is like cognizant of them and willing to kind of say, I'd rather you take a rep or two to like do what you need to, so that way you can functionally do the rest of this rehearsal, rather than having somebody break down, because that breakdown is a harder point to work a person back from.
Yeah, for sure. Thanks, Billy. It can be a challenge for a member to take that step and say, you know, I really do need the minute or two. And I wonder if it's something that, you know, the training, like you alluded to, the training maybe coming on the staff end of things, which I know the Marching Arts Safety and Health Project has been working on doing some more training with staff, which is excellent, and the medical team specifically. And like you said, it's going to take a cultural shift for allowing people to miss a rep, which is, you know, as we all know from our experience, is like one rep is like the end of the world sometimes. Yeah, for sure. So just, I really appreciate that contribution. Anything else about like during rehearsal and kind of making sure that you're being aware, staying safe, staying healthy? Yeah, Natalie.
Yeah, something I talk with a lot of my patients about is the fact that when we're comfortable And when we're in a routine that we're familiar with and we're getting enough sleep and we're eating enough foods that we like, we're familiar with, all of this creates sort of like an emotional cushion around us that helps us to deal with the day-to-day stress that we might encounter. You know, like a weird conversation with a friend, getting a bad grade on a test, however that translates to rehearsal days and on tour. But when we're on tour, we're in a new place. We are probably not getting as much sleep as we're used to, especially in the first couple of days. We're surrounded by a whole bunch of people, don't get a lot of time to ourselves, and like all the familiarity and the routine and the comfort isn't quite there anymore in the same way. And so a lot of people find that their emotional cushion is just gone. And that makes it so much harder to deal with all the little tiny things that might happen throughout the day that if you had a full night's sleep and a really favorite meal in your belly would be really easy to deal with, but everything can just get really intense and feel like a much bigger deal than it is in reality. And I honestly think that awareness of that can help students in the moment of, wow, I'm getting really overwhelmed and feeling really just like this is the worst thing ever, and realizing, oh, I haven't slept very well, haven't been eating the way I usually eat. Maybe that's why I'm feeling this way. And just kind of taking that moment to realize that, like, in the context of your whole day and like what's going on around you, there are reasons that you feel the way you do.
Yeah,
Ethan, I want to add.
good.
Sorry, Ethan, I want to add also that I have seen a shift in the last couple of years in, you know, how hard, I'm like, certainly the DCI participants are being pushed hard. I mean, that's what drum corps is. It tests, you know, a little bit of, you know, of getting you beyond what you even thought was possible for you. And that's one of the things that members say in the end that they feel good about, is that they accomplished something they didn't think they could do. But of course, there's a breaking point. And I really have seen drum corps really back off on their schedules. Maybe not all drum corps, but like, you know, a lot of drum corps now have break days and blocks off and things that, you know, when my kids marched, like never happened. So, you know, I really think that that's being recognized more and more, that, you know, you rehearse smarter, not necessarily longer or more reps. And that's really been great to see the involvement of the activity towards that end.
I agree, and I think that some of it is coming from research in other sports and in sports medicine, and seeing that those long, you know, 2-a-days or whatever from the football team side or the soccer team side of things, like, you're not getting the results you want just by pushing. There are ways to do it to, you know, that is member kind of health and wellness centered. That's, you know, you still get the product that you want, but you're not necessarily grinding up people's bones to do it, which none of us want. That's not what pageantry is all about. So we've alluded to this kind of crash, or this kind of breaking point. So I do want to take a little bit of time and talk about kind of what happens at that moment, and maybe some emergency situations that either you've seen or heard of or participated in, that might happen either, again, during the summer rehearsals, especially, because that's kind of what's coming up in the near future. So like any kind of like physical or mental health emergency that might happen on tour. I know that we've all heard of someone that maybe had an injury. I know that recently there's been, again, like Laura and Natalie and Bailey have alluded to, there's been a larger focus on mental health, especially in these summer tours, but also for high school and the lower level groups, talking about mental health crises. So what are some things we can kind of do to A, keep ourselves aware, and B, be prepared when these things happen?
So, you know, certainly now every drum corps, no matter how big or small, whether it's sound sport or, you know, open class or world class corps, they all have to have some type of licensed healthcare professional on site whenever they're rehearsing. That's the rule. This year, especially, through an extremely generous grant from a family of drum corps alums, they donated a large amount of money to help fund those salaries for drum corps. which and those grants were just awarded. So that's really, really exciting, and we're extremely grateful to them. And they'll be recognized, I guess, by Drum Corps more formally. But anyway, that being said, so Drum Corps are in the process of, or most of them have hired their medical teams. And as I mentioned before, our job in MASH is to support them, because, when they stop and, when they go to an ER, the ER has absolutely no idea. They can't, telling a kid to go home and, soak in a tub and take it easy for the next 2 weeks is irrelevant to Drum Corps. So that's the purpose of MASH, is to, provide those healthcare professionals so that medical teams can consult them. But in any event, to respond to your question specifically, you just have to communicate what's happening. If your question is like, okay, so it's happened, we're now past the point of prevention and something is going on, and you have to be honest. Like, if it's not overt, obviously you break a bone or you gash your head, that's pretty obvious, and you're going to the ER. But the other things, the belly pains, the illnesses, the rashes, the overuse injuries, the concussions. That's a big one that we've really taken a lot of time to study, and probably could have a whole separate conversation about. You have to be forthcoming about communicating your symptoms to your medical team, and knowing that they are there to support you. We no longer are in a climate of, get back out there. We're well past that. Drum Corps has long been recognized as an extremely athletic performing arts activity. And I think people don't really need to worry about that. They need to be honest about their symptoms. They need to go to their healthcare professionals and get the help that they need. They know how to ask for help, whether it be a physical thing or a mental health thing. And again, from the mental health side, we're trying to do a much better job of making our staff aware, and then getting that down to the leadership level as well, so that, they can recognize kids who are sitting by themselves and, maybe not concentrating, not responding, not eating, etc.
Thanks. Yeah. Very much appreciated, Laura. Natalie or Billy, please, anything that you have to add?
So I wanted to, I think this one especially kind of hits home a little bit, just because one of the seasons that I marched, there was an incident of a marching member who was struggling with panic attacks. And at the time I was already working in mental health at that point. So I had been called off the field to kind of help to tend to that situation. And I think for one of the, I think, major things that can definitely be looked at is kind of how to help people through anxiety attacks, panic attacks, some of these instances where the body is reacting very, very strongly to something mentally occurring. To offer up even just a couple of very small things that can be done on a field, even is getting that person ice water almost immediately, and maybe advising them for something as simple as a 4-7-8 breathing technique, which is something I commonly teach a lot of my clients as well. Just about being able to take ourselves back into the parasympathetic nervous system, which is our one at rest, which is generally what we're trying to bring ourselves back towards. So I definitely advise, even if it's just bringing somebody really, really cold water and just encouraging them to take sips of it, just so it kind of provides a shock to the system and helps to kind of reconnect a person. I think even just that on that ability to do that on site and during a rehearsal, I think can be a very big thing, and help a person through a panic attack. Speaking in the terms of something even more high risk than that, speaking of if anybody's engaging in any sort of self-injurious behavior, or exhibiting any sort of signs of any sort of suicidal ideation, anything like that, I would definitely advise having the numbers for any sort of national crisis lines or helplines, things like that. Better to have your member able to be talk to, be screened if they need to get any sort of necessary like mental care or need for some reason to be like just psychiatrically evaluated. It's better that we make those moves and have access to the resources to do that. So even having a couple of those helplines are generally like really, really awesome resources.
Awesome. Thank you. Cool.
I love this conversation. I think just to add to it, so when I was working on the road with the Scouts managing the food truck, there was a student who had been really struggling with not sleeping very well, which had brought up a lot of anxiety that they weren't dealing with very well. And then they had also noticed that their body was changing. They were losing weight. And so every time they looked in the mirror, they were seeing their cheekbones more, or they were seeing just different parts of their body in ways that were really startling to them. And so all of that had kind of come together to maybe sort of what we could call like a breakdown point. They were just very upset, very emotional about it. And so they came to talk to me about it one morning. And I think one of the best things staff members can do when they have a student who is in crisis or having a really emotional moment is just take a few minutes. Like, yes, drum corps is really busy. I was managing a food truck. I was busy, but in that moment, it was really important to take a few minutes, step aside, find a quiet place to talk to that student and just really listen to them, hear their concerns, validate them. Wow, I can really see you're upset about this. I'm sure that must have been really scary when you saw your body look so different. And then with that particular student, we talked about a couple of different strategies to get them eating a little bit better and sleeping a little bit better, just little kind of tweaks that we could make to their routine on tour. But then I think the more important thing in that whole conversation was just like taking that quiet moment to really hear them and listen to them. And like, I was like 22. I wasn't licensed in anything. They just knew I knew stuff about nutrition and they came to me because I was a safe person. And I was kind of freaked out about it, but I used my good judgment. And I think I learned a lot from that experience. And I think when I move forward and talk to other teenagers in other walks of life, I carry that with me as like, if I can just take a moment, create a bit of peace for them, create a bit of listening and safe space for them, then that's one of the most important things I can do.
Yeah, thank you so much for sharing that. It's interesting you use the phrase like kind of create a quiet moment, which feels so paradox, like so diametrically opposed to what marching arts and drum corps is. It's so loud. There's always so much happening. And so anytime that there's a person that, identifies themselves as a safe person to talk to, or a place, a person that someone or member can talk to about what's going on, that's so vital and so important. And it's like what Laura and Billy both said too, if staff members don't know, then those things can't get taken care of. So again, to reiterate some of what you've already said, being alert and aware, watching for those things on the mental and physical side in terms of people's bodies changing, people's affects changing. And then if someone does come to you, being able to listen, being able to hear what they're saying, and then being able to run it up to the chain to talk to the AT or the nurse that's already working with the core, or to be able to know kind of when to reach out and maybe say, this is something that's bigger than we can just handle here, at rehearsal or on the field. Yeah, Laura.
One of the things that MASH gave a presentation at the DCI January annual meeting, or otherwise known as the Janual, that was very well attended, where we talked about having a mental health plan. The participants that are coming into drum corps now, these are not the same kids or I shouldn't use the term kids, young adults, who came into the activity a decade ago, even given all that's happened in the world in the last just couple of years with the pandemic, et cetera, et cetera. And so many of them are coming in with mental health histories, whether they're on medications or not, but they have in some way interacted with the mental health system, either through therapy or, whatever it is. And so when that's identified, hopefully via a pre-participation exam or just some kind of screening that should happen in every drum corps, then there is we actually gave out a written plan that you can develop for when that person has their breaking point, or when they know they need to reach out for help. Do you have a therapist at home that we can communicate via telemedicine? Telemedicine has really made providing healthcare, on the road much easier than it used to be. So, but creating that plan for that person, who is their go-to person? When is their breaking point? Like, when do they need to say something, et cetera, and just really being prepared for that. Because the percentage of participants coming in with some kind of mental health history is really striking.
Yeah, thank you. I can appreciate the importance of all of that. It's good, and again, it's important for us to know, like, when that person has that screen, and then informing the staff, informing everybody kind of how to best handle these situations when they arise. So I'm really glad to hear that those things are becoming more commonplace and more accepted and are being hopefully enforced by our governing bodies. And like I've said at the beginning, this isn't just talking about drum corps, even that's kind of the season that's coming up. These are topics, these are kind of important questions to answer, have answered for all of your marching arts groups, all the way down to middle school and high school. Because if we're trying to prepare those students to be high-level performers at whatever level, we should be cognizant of their mental and physical well-being at all times. I think it's something that's really, really key, not just at the highest levels of performance. I do want to encourage all of our watchers out there on YouTube or Instagram or Twitter. If you have any questions, please feel free to put them in the comments on the YouTube video or tweet them at MAASIN. We would love to answer any questions that you have in our last 15 minutes. Just a quick plug there. Wow.
Quick?
Yes, please, as by all means.
Yeah, I don't know if we had this disclaimer anywhere else, but even though all four of us are licensed healthcare professionals in some way or another, we are not able to give individualized medical or mental health advice here. This is strictly for informational purposes. And if you're having issues with illness or injury or mental health, we really encourage you to speak to your own individual healthcare providers or therapists, because we are not able to give you the advice that you need.
Thank you, Natalie. I very much appreciate that. So yes, if you do have questions about anything we've talked about so far, we'd love to help answer those, but maybe any questions about your own specific healthcare or mental health care needs. Thank you for that clarification. As we're waiting for maybe some of these questions to roll in, this is a more fun question, I think. What are some common misconceptions that you might have heard from students, members, families, or staff members surrounding issues of physical or mental health in the marching arts? I know that, just get back out there is probably one of them. But anything else that you've heard in your experience so far? Go ahead, Nat.
Oh my gosh, I have opinions on this one. So I really dislike the body by drum corps idea that exists in the activity, because there's this misconception that drum corps, because it usually results in really dramatic body changes, usually like weight loss. A lot of people at the end of the summer are super tan, super cut, like super aesthetically pleasing. This is not a healthy or sustainable way to achieve a body like that. And we put it so much on a pedestal. And I really wish that people wouldn't, because it's really not normal for a 17-year-old to lose 30 pounds in 3 months. Like in any other situation, we would be very concerned about their health. But because it's in drum corps, it's fine, right? So yeah, I'll hop down off my soapbox.
No, I really appreciate that. That's something that, we've all seen the hashtags. We've all been there. But I think it speaks to, again, the physical and the mental health side of things too, right? Not everyone's body will respond the same way to even a really intense thing like drum bugle corps in the summer, or even a week of band camp or your mini tours. So not only can it be harmful in terms of like, oh yes, I can drop the 30 pounds, but also in terms of I should want to look like this at the end of the summer, because it's really not great. I can say like a personal anecdote of like looking back on those pictures from DCI finals, like I looked hungry. It it wasn't really a ideal look for me at all 5'9" of me when I was aging out.
Okay, so this one I've kind of, as we've been talking about this, like my brain kind of locked into this idea of kind of like the idea that like drum corps is this like escape from reality. And I've learned when it comes to this notion of like different communities and like especially with niche things like things like the marching arts, it's better to kind of think of the marching arts as like a microcosm of the greater whole. Like you are still going to encounter people within the activity that are going to come from very different walks of life and may not necessarily hold all the same views as you. And so it's not necessarily that we're going to like run away from our problems and like that's going to be the gist of it. I think it's important to kind of be prepared for the fact that we may run into those different adversities and like those different people throughout the activity as a whole. And especially too, like, making sure that we are still facing problems and still like kind of being aware of ourselves in the span of a season and making sure that like we are tending to ourselves and really, really doing that work. Just because I do believe that it's very easy for us to get so entrenched in the marching activity and like the day in, day out of, going at it like through the rehearsal blocks. But, we want to make sure that we're still tending to ourselves. We want to make sure that we're not like kind of pushing aside our own like work as far as like kind of working through our mental health stuff in favor of like, nope, just going to point it all towards drum corps.
Yeah, I really appreciate that, Billy. It is definitely, it seems like an escape. And again, even I keep saying it, but all the way down to, from middle school and high school, like those weekends away, where it's like, of course it's an escape, but also it can't be the thing that's, the one thing keeping you away from, other things you might need to work on. We do have an audience question I do want to make sure we get to before our time runs out. So we have a question. We've seen a lot of progress made. I'm assuming this is in reference to managing members' health and well-being through summer tours or through rehearsals. But what are some things what still needs to be accomplished? Like, so what are maybe some goals for our governing bodies like DCI, BOA, the local circuits, or even down to schools and individual organizations? What are some things that they still need to work on to promote members' health and well-being?
Something I think, and because I work in a school system, this is why this comes to mind, but I don't really understand why student athletes in football and basketball and whatever have to get sports physicals to be cleared to participate, but not every marching band or winter drumline program that's associated with the school requires that. And I think that would be a really great first step is, students who are going to be in athletic activities, whether they're football or marching band, we want to have that accountability of, have they been cleared to participate? Are they healthy enough to participate?
Yeah, definitely. Yeah, Laura.
And to that end, I wholeheartedly agree. And so for several years now, the Marching Arts Safety and Health, since it's like, I think when we became the Drum Corps Medical Project, that was one of our first things that we developed, and they have been redeveloped and reworked just about every year or two, that we distribute and encourage because we're only involved in the drum corps activity. that every drum corps uses those forms. So we have extensive pre-participation sports physical exam forms that we have made available to every single organization. And then this year we added the mental health component to it specifically. And you are 100% right, because that's where you really prevent a whole host of things from happening in the summer. Not every kid should play football. Perhaps not every young adult should do drum corps, every single year. You have to be able to do it. And for some people, like from a mental health standpoint, the touring and living conditions and all may not be right for every participant every single year. I mean, you have to just be very realistic about what that person is going to encounter, and do a really thorough pre-participation exam. I am wholeheartedly 1,000% in agreement with you, and I have been singing that tune for a lot of years. So I really appreciate you saying that.
I think so far as like things that need to, like, the progress that still I think needs to be made. Honestly, I am super glad, like Laura, for mentioning that, like sort of first aid kit, and also even that like mental health has also been added to that. I think that is an invaluable resource. I think that like really across the activity, that should definitely be stuff that like, especially at like administrative and staff levels, that documents like that be like a commonplace thing for us to have working knowledge of, and be prepared with. Because ultimately, like said, like I think we're starting to kind of get ourselves away from like the really, really hard grind culture of like previous iterations and generations of drum corps. And it is certainly great to see that there is more cognizance being put to this, but I do think that this is still going to be an ongoing thing, that like even just that idea of like taking off the single rep, the 2 reps. Again, I still hold that like it will be better in the long run over the course of your season to have a marching member take a few minutes to like tend to themselves and get themselves back into like a level headspace where they can continue to do what they're doing, rather than facing the possibility that they may kind of get to a more crisis point, which is going to be a far harder point to work from. I am a very big advocate for the idea of like a lot of the preventative measures that we do in the here and now, and like when things are not necessarily boiling to a head, are going to be infinitely more valuable to us than when we're trying to come from like trying to bring a person back from a crisis point, which is a much harder task, especially when like you're either on the road on tour or in a marching weekend within the DCA circuit. Regardless, like you want to be able to take those measures early, and better to take them early than to have to do something much harder at a later point.
Excellent. Yeah. Go ahead, Laura.
I just want to add another thing. I have been the chairperson of the Marching Arts Safety and Health for most of the last decade. And I am blown away by the amount, when our organization, which is all volunteer, like we all have our real day jobs, so this is all, we would do things a lot faster probably if we did this for a living, but whatever we identify as a problem or an area that we want to work on, the amount of support and even sometimes finances that Drum Corps International gives us, they wrote a whole policy on like prop safety. They revised all of that to make sure that, the creative aspect of something wasn't taking precedence over the safety for the marching members. Just the protocols they put in place in terms of weather and safety. We have actual meteorologists in our organization that they strongly support. Like I just am very appreciative of, they're helping us put on this webinar so we can orient the Corps medical teams, helping us operate a Slack channel for them. So I just wanted to give a shout out because I know that sometimes the organization sometimes doesn't get really maybe enough credit for trying to put the safety, health, and wellness of the members first. But I can speak to firsthand knowledge. I'm not employed by them. I get nothing from them. I'm just a volunteer. Yeah, it's been really great to see that they're very much trying to work on things. So if there are areas that people have of concern regarding the health, safety, and wellness of our participants in drum corps, at least I'm not involved in the other activities, then they should voice them to us so that we can perhaps see that, that may be an area that we can look into. Again, we're all volunteers, so things don't necessarily happen as quickly as we would like them to, but they will be addressed for sure.
Awesome. Thank you so much for that perspective, Laura. Yeah, it's good to know, and that's like one of the reasons why like MAASIN does what it does. We want to make sure we're getting that out there. And the more that we can do on our end to make all those concerns heard, we hope that organizations like DCI, WGI, BOA, other local circuits, all the way down to schools and individual organizations will hear us and make those changes, because all we all want to do, I'm sure, is make sure that all of our members have, again, not to be cheesy, but like access and safety and are able to be included in the marching arts and pageantry, because that's what it's all about. We're running short on time. I know we had a one more audience question. I don't think we're gonna, if we can do a quick hit, if you guys promise not to go more than like 30 seconds per answer. We have a follow-up to our previous question, or another question. Might there be physicians that might clear a student for drum corps or band, but not really kind of understand the physical or mental impact the activity has? I know that the drum corps, the DCI health form does have like a little blurb of like, make your patient do 60 seconds of activity and then like check their heart rate. But are there ways we can kind of help physicians or other providers know kind of how to clear someone for activity?
Our pre-participation form has a one-page cover letter with just a brief paragraph or two that explains exactly what's this member is going to be involved in from both a mental and physical exposure standpoint during the summer, and so that that those things be kept in mind when the sports physical is done. Our corps is using those. A lot of them are. A lot of them have their own, but our form has like a whole cover letter for the healthcare provider so that we can know what we're looking at.
That's great. And that could even be a resource for other organizations as well to see, like, we all know what pageantry feels like and looks like, but communicating it to providers can be challenging.
Yeah, I'm happy to give you those forms to share. That's fine. So I can certainly email them to you.
Yeah, for sure. Laura and I will communicate after this and make sure that we can do some information sharing. So before YouTube kind of decides that we're done before we actually are done, we have about 2 minutes left. So I would just like to give a big thank you to our three panelists, so Laura, Natalie, and Billy, for donating their time to us and giving excellent, well thought out answers to these questions and to our audience questions as well. Thank you so much to our listeners out there in the internet and social media and YouTube. Thank you so much for attending and participating and submitting questions. And this has been the MAASIN Town Hall on Health and Wellness. Again, my name is Ethan. I am a physical therapist. I am the chair of the Health and Wellness Committee for MAASIN, the Marching Arts Access, Safety, and Inclusion Network. You can find us on Facebook, Instagram, and Twitter by searching MAASIN.